Imagine this. You are lying in a hospital bed, trusting the nurse beside you with your life. The nurse prepares your medication, checks your name, and administers it. But a few minutes later, the nurse realizes something is wrong. The wrong medication was given. What happens next? Does the nurse hide the mistake? Does the hospital blame the nurse? Can the patient die? Can the nurse lose their job? And most importantly, what should a nurse do when they realize they have made a mistake? Today, let us talk something about it. When a nurse makes a mistake, what happens next? Let me tell you a story. Imagine a busy hospital ward. It's 8 o'clock in the morning. The ward is full of patients. One patient needs medication. Another patient needs to be transferred for an investigation. Someone is calling the nurse from another bed. A relative is asking a question. Another patient needs their vital signs checked. The nurse is moving from one patient to another. Then comes medication time. The nurse picks up a medication, checks the patient's name, and administers it. Everything appears normal. But about 10 minutes later, while documenting the medication, the nurse suddenly notices something. The medication given was intended for another patient. The nurse freezes. Her heart begins beating faster. She starts thinking, what have I done? Will the patient be okay? What will happen to the patient? Will I lose my job? What will the patient's family say? This is the moment when the nurse has to make a very important decision. Does she keep quiet and hope nothing happens? Or does she immediately report the error? The correct response is clear. The nurse must act immediately to protect the patient. The first priority is the patient. When a medication error happens, the first concern should not be the nurse's job. It should not be embarrassment. It should not be fear of punishment. This first priority is the patient's safety. The nurse should promptly assess the patient and notify the appropriate healthcare professional according to the facility's protocol. The healthcare team may need to monitor the patient, provide treatment, order investigations, or take other steps depending on what medication was given and the patient's condition. Every medication error is different. Giving the wrong medication dose not automatically mean that the patient will suffer serious harm. Some errors may occur little or no harm. Others can be very serious. That is why the mistake should never simply be ignored. But what if the patient looks fine? This is where some healthcare workers may make a dangerous mistake. They may think the patient looks okay, so let me just keep quiet. No, a patient appearing well does not necessarily mean there is no risk. Some medication effects can take time to appear. That is why proper assessment, monitoring, reporting, and documentation are important. The nurse should follow the hospital's medication error and incident reporting procedures. Should the nurse tell the patient? Communication with the patient should be handled according to professional, legal, and institutional requirements. The responsible healthcare team should provide honest and appropriate information about what happened, what is being done to protect the patient, and what monitoring or treatment is required. Trying to cover up an error can make a bad situation much worse. Imagine discovering later that a healthcare worker knew about a medication error but deliberately hid it. The patient's trust may be destroyed, and the consequences can become more serious. But what happens to the nurse? This is the part many people wonder about. Will the nurse automatically lose their job? Not necessarily. A medication error needs to be investigated. The hospital may look at what exactly happened, what medication was involved, how much was given, why did the error occur, was the patient harmed, was the nurse properly trained, was the medication properly labeled, was the nurse working under excessive pressure, were there staffing problems, were hospital procedures followed, was this an honest human error or deliberate negligence? The purpose should be to understand what happened and prevent it from happening again. Not every mistake is caused by one person. Sometimes when something goes wrong in a hospital, everyone immediately wants to find someone to blame. But healthcare is a team. A medication error may involve several contributing factors. Perhaps two medications had similar names. Perhaps the label were confusing. Perhaps the medication was stored incorrectly. Perhaps the nurse was interrupted several times. Perhaps the ward was dangerously understaffed. Perhaps the medication chart was unclear. Perhaps the nurse was exhausted after working a long shift. This does not mean healthcare workers should avoid responsibility. It means that hospitals should investigate the entire process. If the system is unsafe, simply punishing one nurse may not solve the problem. Another nurse could make the same mistake tomorrow. But what if the nurse was negligent? There is an important difference between an honest mistake and reckless behavior. For example, a nurse who makes an unintended error and immediately reports it is very different from someone who repeatedly ignores safety procedures or deliberately gives medication without proper checks. Professional accountability still matters. If an investigation finds serious negligence or misconduct, the nurse may face disciplinary or professional consequences according to applicable rules and regulations. The goal is not to create a culture where nurses are afraid to report mistakes. The goal is to create a culture where nurses make responsibility and patients remain safety. What should nurses learn from this? One of the biggest lessons is this: never be too afraid to report a mistake. If you make an error, don't waste precious time trying to hide it. Stop, assess, inform the appropriate person. Follow the emergency and reporting procedures. Document accurately. Learn from what happened and make sure steps are taken to reduce the chance of the same error happening again. Remember, a mistake that is reported early can sometimes be managed before it becomes a tragedy. A mistake that is hidden can become much more dangerous. What should patients and relatives do? Patients and relatives also have an important role. If you are giving medication in a hospital and you don't know what it is okay to ask, what medication are you giving me? What is it for? How should it help me? You should also tell the healthcare worker if you have allergies or if you have previously had a reaction to a medication. But if you suspect a mistake has been made, try not to immediately become violent or abusive. Ask questions, seek clarification, allow the healthcare team to respond. Remember that aggression does not make a medical emergency safer. The biggest lesson to learn: at the end of the day, medication safety is everyone's responsibility. Nurses must follow safe medication practices. Doctors and other healthcare professionals must prescribe clearly. Pharmacists must dispense accurately. Hospitals must provide safe systems. Patients should communicate allergies and concerns. And relatives should cooperate with healthcare workers. Nobody enters a hospital hoping to make a mistake. But when something goes wrong, what matters greatly is what happens next. Do we hide it? Or do we respond quickly, honestly, professionally, and then compassionately? So, the next time you hear that a nurse made a mistake, remember that there may be an entire story behind what happened. The nurse should be accountable. The patient deserves honest and safe care. The hospital should investigate what went wrong. And the healthcare system should learn from the incident, because the ultimate goal is not simply to find someone to blame. The ultimate goal is to make sure the same mistake does not happen again. And to every nurse watching this, you are human. Be careful. Follow safety procedures. Ask for help when you need it. And if you make a mistake, don't hide it. Act quickly. Protect the patient. Report it. Learn from it. Because sometimes The most important decision a nurse makes after a mistake is not whether to be afraid. It is whether to do the right thing. If you found this video helpful, please like, subscribe, and share it with another nurse, healthcare worker, patient, or relative. Let's continue having honest conversation that make healthcare safer for everyone. Thank you for watching and for listening.